Bye.
Bye.
So, how many seizures did you guys count?
3.
You did, yeah, 3 seizures. And that's pretty much how they are. There's no postictal period. There's usually no incontinence. There's no oral trauma. They just kind of go out and they're a little bit confused for a while. Again, not a big deal, but you can imagine they kind of come out of that and you're looking at them weird and concerned, right? Kind of keep your emotions down a little bit and just say, hey, I think you just had a seizure. You see this a lot in kids, all right? So if you're trying to determine if that child is having a seizure, it might be difficult to tell. But if they start having many of these, is that something that we need to do? Do we need to do something about that?
Would giving them percent help?
Absolutely.
Yeah. Give some percent.
Seizure activity. Now, generally, we're withholding benzodiazepines for our tonic-clonic seizure activity. But if they're having multiple episodes of this, I absolutely would give them a dose of a benzodiazepine because it's still a seizure. It's still seizure activity. Granted, use your clinical judgment. How is the patient maintaining? Are we still getting perfusion? All right. Oxygenation is going to be your priority. If you're getting all of that, you may not need to give them anything. Just give them a ride to the hospital. This is probably something that they've been dealing with, and in this case, they induced his seizure by increasing his threshold by making him hyperventilate. That was one of his triggers. Just like Aaron was talking about, lack of sleep was one of the other guy's triggers. Everybody's a little bit different. Status epilepticus, right? Multiple seizures without return of consciousness. They just remain post-tictal and then have another seizure. So with that being said, what is our benzodiazepine that we can give? All right. So we've got Versed. We've got Ativan. And what else? Valium. All right. What is our dose for Versed for seizures?
1 to 2.5 IV.
Is that for seizures, right?
Yeah.
So 1 to 2.5 IV IO. Is there any other way that we can give Versed? We can give it intranasally, right? Now,
IM too,
IM, does it say anything about doubling the dose?
Yeah, it says you're going to give 0.07 to 0.08 milligrams per kilogram to a max of 5.
Okay. Do you guys remember that? 5 milligrams is generally what we're going to give our adult patients. IM. Okay? All right, what about Ativan?
Yeah, I don't know if that's
Right? This is what your book says.
2 to 4?
0.05 milligrams per kilogram to a max single dose of 4 milligrams. Okay? And that's going to be IV or IM, intramuscular. You can repeat this in 10 to 15 minutes to a max of 8 milligrams in 12 hours. That's how your book puts that in. Valium, 5 milligrams, IV or IM. You can repeat in 10 to 15 minutes to a max total dose of 30 milligrams. That doesn't say that, but generally that's within a 24-hour period. All right, so you can't give them any more than 30 milligrams.
What if you give them you give them 5 milligrams of IM Versed, it doesn't work, and you jump to Ativan?
If you happen to have more than one benzodiazepine, the thing when you start mixing benzos is they end up becoming like synergistic. You'll actually increase the potency of both medications. So you run the risk of overdosing them by doing that. It's not like our pain medications where, if we have to start off with morphine and we move it to fentanyl, we can kind of control it a little bit by titrating it, and if we have to, we can get a little bit of Narcan, right? Benzodiazepines, it's a little bit different. That's generally why most places either have Versed and maybe a Valium or Versed and Ativan. Valium they tend to give to our pediatric patients. Mostly because Valium, because of its absorption ability, it can actually be given rectally. So they'll give Valium rectally. So a lot of times, if your agency is still carrying Valium, it's for that specific reason.
So for Versed, would you give it at 5 milligrams for intranasal also?
Now I'd go 1 to 2.5. Yeah. So remember, your intranasal dose is always going to be your IV dose.
Okay.
For any of those medications. All right. So what do we do if we overdose them on our? Well, first of all, what are these 3 things going to cause, other than sedation? Respiratory depression, right? So these are going to cause sedation and respiratory depression. So it's really the respiratory depression that we're probably more concerned about, because now we're going to have to deal with protecting their airway and possibly assisting their ventilation. We already know that with our narcotic pain management, we've got Narcan. But what do we have for our benzos? It's actually in the National Registry list of drugs, but hardly anybody carries it. Okay, don't pop the top on this, please.
What is it?
Talk to you guys about it.
What is
I won't read it.
Flumazenil?
Flumazenil.
Emergencies?
Yep. Also called Emergencies.
Oh.
Okay, so this is pretty much our benzodiazepine antagonist. However, why don't we see this on ambulances very often?
Is it dangerous?
There's a lot of real dangerous side effects to giving it. And I was reading an article this morning. You ever heard of, I think it's Rogue Medic? It's got like a blog on the internet. They usually do a lot of videos and stuff like that. I was reading one of his blog articles about Romazicon, and basically what he says is the reason that we're not allowed to use it in a lot of our county protocols is because we're just not smart enough. That's what he says is the belief, which is kind of insulting, quite honestly. But what are the side effects to flumazenil? The biggest one is seizures. Okay, so let's kind of put this in perspective. So, patient had a seizure, we give them benzodiazepine, we overdose them on it, now we're going to give them Romazicon, which is going to cause seizures. So then what do we give for seizures from the Romazicon? Give them more benzos. Now we're kind of going down that slippery slope that's not going to work. So the biggest reason we don't give flumazenil is it has a high likelihood of causing seizures that are very, very difficult to get somebody out of. So generally when Romazicon causes seizures, they're going to go ahead and RSI that patient. That's about the only thing, and just let the benzodiazepines work their way out of the system. That's generally what they're going to do. So, just to throw this up here, what is our dose? All right, so Romazicon or flumazenil. What's that? 0.5. Where are you seeing that? Is that in the book? Oh, is that? Oh, yeah. That's how much is it per mil, right?
Yeah.
So the dose is 0.2 milligrams IV over 15 to 30 seconds. After 1 minute, it hasn't reversed our overdose, our sedative and respiratory depression. Following a minute, you can give another dose of 0.3 milligrams IV. You're going to give this over 30 seconds. Why do you think the time frame is kind of long there, 15 to 30 seconds? A lot of it has to do with if you give it too fast, you cause seizures. Okay? So this is one of those medications you want to give slow IV push, right? We have a max dose of 3 milligrams per hour that patient can receive. So as long as you don't give them more than 3 milligrams in an hour, you should be fine. Where's that vial? Still floating around? Oh, did you guys look at it over here? Yeah. Were you guys, did Tom last teach you guys a lecture last week? Was it right? He brought me that, so you may never see this except in the hospital. So I wanted you guys to at least see what the vial looked like. Unless you go somewhere like Texas, they probably use it, or Washington probably uses it as well.
If someone were to drink that, they would have
Yeah. All right, real quick, the last thing I'm going to talk about, and I'm going to send you guys to lunch, I'm going to skip over syncope. What is syncope if I just talk about it real quickly?
seizure.
Right.